We are Home Health Resource Group. We are a growing network of quality healthcare services and program providers, and the only company that offers a complete range of services across all facets of patient care at the home setting. Hhrg manages a network of Medicare-Certified Home Health, Palliative, Hospice, and home care agencies. For your patients who would benefit from home health care, we are ready to assist in a seamless transition of care to home. Hhrg has unique patient-centered care programs that are seamlessly implemented across the board, providing quality patient care and satisfaction. Our experienced team of clinicians are highly trained to provide the most comprehensive care even to patients with multiple comorbidities, even to those with the highest of acuity. We are game changers in our field. While all other agencies offer the same services, we strive to do it better by implementing our unique programs for patients admitted to our services. We offer the SMART program, or the Specific Management of Ailments and Rehabilitation Treatment for Nursing. STAR program is Strategic Treatment in Aided Rehabilitation for Therapy. HOPE program, Hospital Occurrence Prevention Enforcement. Our clinical team follows pathways and blueprint of comprehensive patient-centered care plan to reduce hospital readmission rates and preventable emergency department utilization, and to increase patients' and families' engagements by providing them with quick guides, booklets, and kits for diseases that have been identified as the frequent causes of rehospitalizations. With our commitment on improving patients' outcomes, we mitigate all risk factors prior to admission. Upon start of care, patients under Hhrg-operated agency will be enrolled to a specific SMART program. The program will map out an individualized plan of care from day one to the end of the episode, including teachings, identifying roles of patients and caregivers, and the optimal compliance to the plan of care. This also includes recognizing key milestones, red flags, and other indicators, and managing and reducing hospitalization risks until the patient is safely integrated back to the community. Similar with our SMART program is our STAR program, which is the blueprint and pathways that our rehabilitation team follows. We provide them with quick guides where we outline rehab program, home exercises, and disease management protocols. We share your goals and objectives to ensure a patient remains healthier and engaged. HOPE reinforces the SMART and STAR programs and reducing hospital readmission rates and preventable ER utilization. Our clinical team always ensures practice of warm handoff process for consistent delivery of personalized and accountable care. Upon the start of care, the admitting clinical and PT team will assess and determine the level of care and intervention needed by the patient. The patient will then be enrolled in the appropriate program. The patient will sign consent forms. During the succeeding clinical visits, the patient will be provided with quick guides, booklets, and necessary medical equipment and device if needed. The quick guides are color-coded in green, yellow, and red, which outline the disease management guidelines. We teach patients and caregivers to play an active role in the patient's recovery process by encouraging them to be compliant on the care protocols in the green section. Items in the yellow section are watch-outs and indicators, which signal the need and triggers the coordination of the patient to our clinical team. We work closely with the patient's primary care physician, and we will reach out to them for any change in medical condition that arises. Our HOPE Enforcer will provide an additional layer of care via our telehealth services on days when our clinical team will not be on site. The Enforcer reaches out to patients in the most critical period to manage the risk of rehospitalization. These calls complement our clinical team's interface with the patient, with the daily monitoring of the patient's conditions and vitals, medication reminders, and compliance to plan of care. We will be able to immediately address any intervention needed to keep the patient safe. Any conditions that fall under the red section, the patient is advised to call 911. As soon as the patient is safely sent back home, our clinical team is on standby to perform ROC or resumption of care. The SMART and STAR booklets are teaching platforms we provide to our patients. Based on the presenting symptoms and health issues identified during the assessment, follow-up visits will cover a more comprehensive approach to their disease management process and is aligned to the patient's identified progress to goals. Patients are coached to do daily self-monitoring based on relevant health metrics that would help our clinical team to better evaluate patients' progress to recovery. This also enables us to capture the early manifestations of exacerbations, thus preventing ER visits and rehospitalization. The programs aim to address any abnormal or emergent finding and red flags at their onset, to resolve to alleviate any change in patients' conditions, and to continue implementing the teaching pathways until the patient is very well equipped with the home management of her disease. We share your devotion. Together, we practice immense responsibility and accountability in patient care. Like you, patients are at the center stage of our practice. Patients must always be at the center of healthcare. A patient-centered healthcare culture isn't just nice to have, it's a need to have. There's really no excuse for delivering poor care, and we're here to help. Connect with Hhrg, and let's win lives.